Thank you. Thank you. Hope you're all enjoying your dinner. I had my salmon. It was very good. So welcome. Exciting night. This is really the excitement and the cherry on top of all of the work that's been happening over the past day at the conference, as well as really over the past year as it relates to Primary Care Collaborative and the mission of the collaborative focused on advanced primary care. We're going to, as Ann said, we have a history at the PCC of providing and giving and recognizing organizations and people for the efforts that they've put forth. And we're going to start with the Advanced Primary Care Practice Award. There are 3 awards that we're giving out today. And what I'm going to do throughout the evening is read to you the purpose of the award, what the award is focused on, and then we'll bring up an additional individual to present the award to each of the winners. The Advanced Primary Care Practice Award recognizes an extraordinary primary care practice that serves as a model for transformation through innovation as reflected in the shared principles, including patient and family-centered team-based care and high value. Please welcome to the stage our 2022 Advanced Primary Care Practice Award sponsor, the American Academy of Pediatrics. Mark Del Monte. You're next. All you.
Thank you very much, Rob, and thank you all for being here at this exciting event. It is a real privilege for the American Academy of Pediatrics to honor this award winner and to sponsor the Advanced Primary Care Practice Award. The first award winner of this evening is Winding Waters. Winding Waters serves a frontier county in northeastern Oregon, near Hell's Canyon and the stunning Wallowa, I knew I was going to get that wrong, Wallowa Mountains, the historic home of the Nez Perce tribe, and they're also simultaneously training a future generation of primary care clinicians. This practice and its leadership exemplify what it means to be community-based primary care. Winding Waters serves as the public health system during the COVID-19 pandemic because the county did not have one. At the same time, Winding Waters continues to innovate with its involvement in state and federal payment and delivery reform. The practice is involved in shaping value-based payment strategies in the state of Oregon and through engaging with the Medicare Shared Savings Program. For its remarkable breadth of innovation and commitment to its community, the American Academy of Pediatrics is pleased to present Winding Waters Community Health Center the Advanced Primary Care Practice Award.
Thank you all for the warm welcome and for recognition for our team. I'm Nick Powers, the CEO at Winding Waters, and they sent me because I didn't have any patients to take care of. I definitely tried to get Dr. Powers to join us, and she said, sorry, buddy, you got to go, because she had patients scheduled. It's amazing to come to the big city from a frontier community of only 7,500 people, 2.3 people per square mile, more livestock than humans, and find other people who understand what we're what we're living through, right? The challenges and the opportunities. And I didn't expect that. It's pretty neat. We provide medical, dental, and mental health care in Wallowa County, and the mention of no public health, we literally do not have a local public health authority because the county shut it down. And so we stepped into that void, and we're working with the OHA, and then COVID came along, and it was like, oh, we need your help with this. And we said, okay. Because we're taking care of our family, friends, and neighbors. We're taking care of folks that we know and that we see every day in the clinic, in the grocery store, kids' ball games. And I think, that is that point of connection for a lot of our team. We know we're there for people when they need walk-in care. We have same-day access for all of our services. And then we want to make sure we're there for those long-term healing relationships. We want to be that usual source of care for every person in our community that needs it. And so to hear all those kinds of words from you all today has been really inspiring, and I thank you for that. Because we always do things in teams, I asked staff to vote on who should accompany me, and they voted for our one clinical pharmacist, Mike Farley, who's here with me today. And so he'll share a few quick mentions, but he is a person on our team that ties together so many of the different pieces, and you're about to hear just a glimpse of that. But I thank you, and I yield back my time to this distinguished gentleman from Eastern Oregon.
Thank you so much for the welcome, and it's an honor to be here representing our team. I was really humbled by them when they voted me in, and so really I'm glad to help accept this reward in their honor. And I think it takes a team for us to be able to reach the point of this level of care for our patients. And so, it starts with our care access team who checks the patient in and creates that welcoming environment. And then our medical assistants that room the patient and really set the stage for a rewarding visit with our outstanding providers that offer that high level of care. And so embracing our team, we're able to serve people like a 19-year-old young lady whose grandma brings her into clinic in withdrawal from her substance use disorder, and we're able to employ the pharmacist to help with this buprenorphine induction, and in the course of all of that, get connected with our community health worker and our behavioral health team, so that we're able to wrap our arms around that patient in the moment, and they came in for care. Or maybe it's that 50-year-old some or so male who hasn't really been to the doctor for quite a while, but boy, the tooth is killing him. So they come in for a dental visit, and we discover they have hypertension, and we're able to hand off to the medical team to be able to serve that patient. Or, maybe it's the 69-year-old lady who just hasn't been feeling very well and gosh, has no idea why she's losing weight like crazy. And we start the workup, and we discover her blood sugars are in the 400s and she needs insulin therapy. So we get the pharmacist to help get some insulin on the spot, our diabetes nurse educator to help her, and the community health worker to make sure that any community resources they need are taken care of. And that patient's able to leave then assured and not nearly as fearful from that kind of a diagnosis as they possibly could be. So without that team, we could never make all this possible. So we are truly honored to be recognized for the team effort. And on behalf of our team, we thank you for that. So thank you very much.
That was awesome. Congratulations to Winding Waters. And I kind of felt the tremors over here with Get the Medications Right Institute. When the clinical pharmacist was mentioned, they almost rushed the stage. So, what a great example. Okay, we're off to a great start. Award number 2. This is the Primary Care Community Leadership Research Award. And this award honors an individual who has demonstrated remarkable leadership and/or research to ensure that primary care is foundational to community or state healthcare reform efforts. Please welcome to the stage our 2022 Primary Care Community Leadership and Research Award sponsor, CVS Health. Welcome. David?
Thank you, and I just want to say what a privilege it is for us from CVS Health and my colleagues over here in Table 2. We're very proud to be sponsors of the Primary Care Collaborative, and particularly excited to be sponsoring this award tonight. So our next award winner is Dr. Ebony Winford. Dr. Winford leads the health equity initiatives for the Cherokee Health System, a federally qualified health center in the state of Tennessee. Most impressive is Dr. Winford's work with Centro Hispano and the Volunteer Ministry Center, a resource center for individuals experiencing homelessness, where she works to build partnerships between community leaders and primary care systems. Dr. Winford's leadership also includes projects addressing hepatitis C, HIV, PrEP, affirmative care for trans and gender nonconforming individuals, medication-assisted treatment, and the NIH All of Us research program, a project to build a diverse and representative healthcare database. Through these efforts and more, Dr. Winford is making significant contributions to ensure that primary care is foundational. This year, CVS Health is pleased to present Dr. Ebony C. Winford with the Primary Care Community Leadership Research Award.
We practiced how I would hold the award, and I would like to say I did it. No fingerprints. And so, but thank you all so much for this honor. I want to go ahead and start by thanking some individuals. I want to thank my husband, Dr. Brandon Winford, who accompanied me here. I want to thank Dr. Stephen Gillespie for submitting my nomination, and Dr. Stacy Obeid, who's not here, but apparently the second that the call for nominations came out, she sent the message like, oh, let me tell you, I have somebody. And the value of having a sponsor, someone who will speak your name in places that you are not, that is so important. And so I do this work for those who have sponsored me, who have allied themselves with me, and who have advocated for me. I want to accept this award on behalf of my grandmother, Loretta Morton, who died on March 17th of this year. And for the last 19 days of her life, I had the privilege of providing her 24/7 care. And we had amazing conversations at 2 in the morning, 3 in the morning, didn't matter. What is time? But her heart for service is where I have the drive that makes me get up every day, that makes me go into spaces where I may be the only one who looks like me, to make sure that anyone can receive care regardless of their ability to pay. So I work at Cherokee Health Systems as the Director of Research and Health Equity. In this capacity, I get to work with community partners to make sure that they know that regardless of someone's financial circumstances, regardless of their ethnicity, the language they speak, primary care does have a place for them. We are the central access point to a strong healthcare system. I also work training organizations across the country in integrated care to make sure that while the workforce is still on the struggle bus, we can equip the primary care workforce to provide the needs of the people who present for care. During the pandemic, as we all know, it was a mess, y'all. It was a mess. The one thing I will say is that it became a sounding board and an opportunity to speak to legislators and people with the power to make changes, and simply telling stories such as the one I'll share now. I had a patient that I meet with every month just because. I'm a psychologist, so like that's how I roll. But she calls it her tune-up appointment. We come in for her tune-ups, but when she did not present for her tune-up appointment one month and didn't answer the phone, I knew something was up. A month later, she called and said that her brother had died of COVID-19, and so she could not attend her appointment or accept a phone call because she had spent and used all of her telephone minutes arranging for his funeral. That's not acceptable to me. It's not acceptable. And I was thankful that I was in a position where I was able to reach out to some colleagues, and we wrote some information, some op-eds. We wrote interviews and podcasts and participated in things to really advocate for the extension and the expansion of telehealth and broadband internet services for people who don't have it. I would not, let me rephrase that. I will not stop until broadband internet access is one of the 10 essential healthcare benefits for our patients. And so to all the patients that we have the privilege of serving in federally qualified health centers who have been underserved by systems of power in the past, I accept this award on their behalf, in addition to my grandmother, Miss Loretta. And so thank you all so much for this opportunity.
Truly inspirational. Thank you for sharing that that touching story and for all you've done, as well as adding struggle bus to my vocabulary. So I'm going to use that. Okay. We now have our final award of the evening. And Anne, when she kicked us off here today, she referenced Barbara Starfield. And I have bear with me as we walk through the intro or the overview of the award. It's a little bit longer than the others, but I can assure you that it's not even 1/16 the length of the winner's accomplishments. PCC established the Barbara Starfield Primary Care Leadership Award in 2012 to honor Dr. Starfield, whose distinguished career at Johns Hopkins School of Public Health spanned over 5 decades and included seminal research that highlighted the critical role of primary care in driving health system transformation. It recognizes her enduring commitment to the philosophy that all individuals should receive comprehensive, coordinated, and person-focused care. The award is presented annually to an individual or organization who demonstrates exceptional work toward advancing the goals of primary care and a strong commitment to person-focused care. The past awardees are Dr. Starfield posthumously, and that was in 2012, as Anne had mentioned earlier, followed by Dr. Richard Barron in 2013, Deborah Ness in 2014, Dr. Calvin Sia in 2015, Dr. Paul Grundy in 2016, Dr. Michael Fine in 2017, Dr. Karen DeSalvo in 2018, Dr. Douglas Henley in 2019, Dr. Rebecca Etz in 2019, and last year, in 2021, Dr. Maria Portela Martinez. Please welcome back to the stage our 2022 Barbara Starfield Primary Care Leadership Award sponsor, Elevance Health.
Dr. Clancy's experience and expertise touch almost every aspect of healthcare. She's a general internist, a nationally recognized physician executive, an academic, a health services researcher, a journal editor, and so much more. From the PCC perspective, her legacy is clear. She was an early champion of the patient-centered medical home and continues to champion the shared principles of primary care today. Working at the VA gave her the opportunity to listen to veterans, champion their stories, and leverage the power of storytelling. The VA strongly encourages veterans to ask questions and share their experiences. That approach helped address vaccine hesitancy during the worst of the COVID-19 crisis. She and her VA colleagues bolstered vaccine confidence by listening to veterans. From the patient-centered medical home and the VA patient-aligned care team to comprehensive medication management and instilling vaccine confidence, Dr. Clancy has devoted her career to advancing person-centered, evidence-based primary care. This year, Elevance Health is pleased to present Dr. Carolyn Clancy with the Barbara Starfield Primary Care Leadership Award.
Well, good evening, everyone, and thank you so much for a lovely introduction. So lovely that I am briefly tempted to say, we'll stop here, but I am really deeply honored to accept this award in Barbara Starfield's name, and I thank you from the bottom of my heart. She was an esteemed colleague and a friend, so to be recognized with this award named in her honor is quite moving to me. And I really, really want to thank Get the Medications Right, who nominated me for this award, and I want to thank my husband, and I'm thrilled that he could be here this evening, Bill Kaplan. You know, I was listening to the song For Good from Wicked the other night. There are people who come into our lives for whom words can't begin to capture their impact. For Barbara, exceptional, inspirational, ahead of her time. She was all of these and so, so much more. Looking back at a presentation I gave 10 years ago at a symposium honoring her at Hopkins, I saw that I had described her as driven, tireless, engaging, straightforward, never shy. I want to be clear about that. A mentor, a champion, a role model, and a heroine. In other words, I was a fangirl before we even had that term used. She was clearly a trailblazer in health services research, examining early 90s, variations in the proportion of physicians in a country who are in primary care and how that relates to overall spending and outcomes for the population. I will leave the results to your imagination, but the U.S. was not out in front. And for demonstrating why children's health should be a distinctly separate focus of health services research. She also was the first health services researcher I knew of who directly collaborated with the policy world, working with the Medicaid group in Maryland very, very early on, so that policymakers could understand the impacts of their policies on overall costs and, most importantly, outcomes. And she worked closely with the Community Health Centers program, which provides primary care to at least 20 million Americans. So throughout her extraordinary career, Barbara was laser focused on social determinants of health. I'm not even sure she would recognize SDOH as an acronym because we think about it that way now, but to her this was just part of the fabric of primary care. Her passion for health equity not only sparked new lines of inquiry, but she was also a founding editor of the International Journal for Equity in Health, as well as co-founder and first president of the International Society for Equity in Health. I mean, this goes back years, so you can see really what a forefronter she was. So I started to reflect on what would Barbara Starfield say about primary care and COVID-19. So one of the hallmarks of anyone's legacy is how well their words and work withstand the test of time. So imagine for a few minutes what Barbara might have observed about the constellation of primary care challenges posed by COVID-19, and consider the many ways her work has paved the way for how we're now assessing them. Certainly, the pandemic, which is not over, has been challenging for all healthcare workers and especially for primary care clinicians. And at the same time, primary care has almost never been so important. To quote a recent blog from Health Affairs, primary care has always been about people's lives and complicated realities. It necessitates a relational response now more than ever. And I'm sure Barbara would have echoed that if she wouldn't have written it herself. It is not now and never has been linear. So I'm confident that many of you, like me, have fielded volumes of questions from patients, friends, family members, coworkers, and so forth. For example, how do we quarantine here when 2 of us are positive and 2 aren't? Okay, I was exposed to someone with COVID 3 days ago. I've tested negative twice, and I have an appointment for the bivalent vaccine. Should I go do it? And of course, queries about masks, experimental treatments, whether it's safe to take vacations, and so forth. But most importantly, and I think Ebony's remarks really underscored this, it was impossible to diagnose and effectively treat people infected with COVID without knowing in detail about their living situations and their multiple challenges that they were trying to balance, whether that was work, caregiving, homeschooling, et cetera, or all of that. And all of this Barbara would have known intuitively. And additionally, because of her pioneering work in health equity, we knew how to be keenly aware at VA of how the pandemic would affect minorities. So really working with some amazing colleagues, we fielded a survey about vaccine uptake even before the vaccines were developed or ready for, to be approved, and learning most about what our patients wanted. And what they wanted was information from a trusted source, and for most of our veterans, that was their primary care clinician before opting from a vaccine. They didn't want to be told, come right here and just line right up, trust me. They actually wanted that to be coming from someone they trusted already. So I don't think that would have surprised Barbara at all. So as we approach what we're calling an endemic phase, Barbara's critical eye and passion for primary care continue to resonate. For example, we're now going to be facing big challenges of addressing deferred care. How do we identify people at the highest risk of poor outcomes and encourage them to come in? And as we navigate a pretty dramatically changed care landscape with both opportunities and, as all of you have been discussing today, big challenges, and more people coming in for primary care, the question is, how can we collaborate to assure that primary care continues to live up to its promise? Now more than ever, primary care is still too important to fail. And we're incredibly fortunate to have the outstanding research and legacy of Dr. Starfield to guide us as we continue to navigate these challenging times. So I'll just close by saying with deep appreciation, I accept this award, and I accept it on behalf of all of the people who are working so hard right now, both for the veterans we serve, but for people across this country for whom it is more important than ever that primary care not fail. Thank you for this incredible honor.
Well, congratulations, Dr. Clancy. And congratulations to all of the award winners this evening. I'd like to not only thank them and congratulate them again, but also thank the sponsors of tonight's dinner. If we could have a round of applause for everybody who made this possible. And now to close us out, I'm going to bring Mark Del Monte back to the stage.
Thanks, Rob. Rob, thanks for landing the plane today. Well done, all day. That's a hard job, and we've been on task and on time the entire day. So, Rob, thank you for that. I won't keep you. I just wanted to take a moment or two here at the very end of day one to reiterate on behalf of the Board of Directors our gratitude to our sponsors who made the conference possible, for the sponsors who made this event possible, to congratulate the award winners for their just incredible work day to day, and for bringing your story and your inspiration to this event this evening. I think that it is important for us to be in the same room together once in a while. We've missed these events over the last couple of years, and so we're glad to be back. It's important to share a meal and remind ourselves that we are all together, united in common cause around a really, really important thing that matters, from rural communities to the biggest of cities. The centrality of primary care in the health and well-being of infants, children, young adults, and the elderly. We are a powerful community, and we have a powerful story to tell. It begins one at a time with each of the patient stories, some of which we heard, to the largest of systems like the VA. And so if we can combine, if we can align our voice, if we can sit around a table together like we do at the Primary Care Collaborative, we can amplify each other's stories and tell every policymaker in every capital, every decision maker over every payment structure, every leader of every health system, that if we're really going to make a difference in the United States in the healthcare system, we begin and end with primary care. It needs to start right now, and the beginning of it is payment. So let's get going. Let's begin tonight. There is no reason for us to be shy about saying that underinvestment in primary care results in excess morbidity and mortality. That's just true. That's just true. And so I think this is an important moment. We're back together in real life. We're only halfway through. We got a whole other day tomorrow. I mean, what will we learn tomorrow? But it's an important marker of time that at this meeting in 2022, something important happened. And we committed ourselves to primary care anew, and we committed ourselves to this community of people working together, rowing in the same direction in order to enhance primary care in every community across this country. So I'm grateful to you as participants who have come to this meeting. This is a hard time of year, right? It's in the middle of December. The traffic is a nightmare. Thank you for getting through all of that in order to be with us today. But most of all, thank you for your commitment to the cause and to being a part of the work of the Primary Care Collaborative. Have a good rest of your evening. We'll see you bright and early tomorrow morning, and thank you very much.